Hi, everyone, and welcome to the Congestive Heart Failure Workshop from Dr. Curnew's clinic. My name is Monica.
I'm Ivy.
I'm Maria.
And I'm Sonia.
And today we'll be presenting for you what congestive heart failure is and some tips and tricks to kind of maintain your health throughout.
You know, shortness of breath has multiple ways of presenting itself. And first of all is to figure out why you're short of breath, it's complicated. One of the diagnoses is called congestive heart failure. You're going to see a video that's going to last about a half an hour. Take the time to listen through, stop and start and rewind, and pause, move forwards. One of the things that I learned is that getting all this right takes time and effort, and giving you information to manage your health is important. So congestive heart failure is simply the heart cannot pump enough blood to supply the vital organs, or it does so at a higher filling pressure. You're going to see lots of information and you see lots of causes. Now, most of the people that we're evaluating for shortness of breath have more than one cause. It could be just that you're deconditioned, you're overweight, you're anemic, you have lung disease, or you have congestive heart failure, or parts of all the above. So we're going to spend a time exploring that. And congestive heart failure is really changed quite a bit. What happened when I first started my practice is if you had a heart attack, if you got 10 years, that was wonderful. Now, after a heart attack, you're getting 10, 20, 30 years in some cases. So we made great inroads. But what happens as time goes off, as the heart muscle gets weaker or stiffer, and you're going to learn that systolic dysfunction is a weakened heart muscle. Normal ejection fraction is about 55%. And you're going to learn critical values. Once your ejection fraction is less than 40%, that means that the blood's not pumping enough each time the heart pumps, you're in trouble. And also, you can have congestive heart failure, or the inability to deliver the blood supply to vital organs. The heart muscle is still contracting well. The systolic function, or the ejection fraction, is normal, but the heart becomes stiffer. So we learned a lot about that. And to me is that how do we educate, how do we learn, and really enjoy this workshop, this video, and show it to friends and colleagues, neighbors, even enemies. Everybody should learn more. And the students and the people involved did a fantastic job of breaking the components to this. So really enjoy.
So before we get started, we just had a quick icebreaker activity. So here's a case study of a patient called Stethoscope. He's a 63-year-old male. He's had 2 heart attacks in the past. He also has high blood pressure and type 2 diabetes. And he's come into the clinic and he's been complaining of shortness of breath for the past 4 months. He's been feeling very tired, and he went and he got a special blood test that the doctor ordered called BNP, and it measured at 600 picograms per milliliter. So today his blood pressure was 98/82, and he had a heart rate of 110. So can anyone guess the diagnosis? Okay, so if you guessed that it was congestive heart failure, based on these symptoms and further testing, that would be the correct answer.
If you ever find yourself short of breath at rest, short of breath during physical activity, or waking up at night catching your breath, that's probably why you're listening to this workshop today. And these are all signs and symptoms of varying degrees of severity of congestive heart failure. And today we're just going to talk about what it is and how we can appropriately manage and treat it. So what congestive heart failure is you can think of your heart as a pump, and heart failure is when the pumping action of your heart isn't really strong enough to move blood around your body and to meet the body's needs for oxygen and other nutrients. And so what happens is the heart begins to pump at a higher filling pressure, and eventually, when your heart fails, fluid builds up around the heart, and it begins to back up in places such as the lungs, liver, abdomen, and extremities. And fluid backup in the lungs can cause shortness of breath, and you can often hear patients being asked by volunteers if they've seen swelling around their legs, and that's just because fluid backup in your extremities causes swelling in the legs. When your heart starts to fail, your body's actually really good at compensating for that initially. So your body's goal when the heart starts to fail is to increase cardiac output. And it can do that in 3 ways. It can either enlarge, so the heart begins to really stretch. And as you can see in the picture on the right, the left side of the picture, you can see the heart has really stretched out. And this allows the heart to pump more blood with more force, but that only works for a short period of time. In the long run, the heart begins to become weak and really thin, and it further perpetuates heart failure. The second way your body compensates is by increasing muscle mass. So the contracting cells of the heart actually get bigger. And as you can see in the picture, on the right side of the picture, the heart muscle walls are really thick, and that helps the heart to pump really strong for a short period of time. But once again, in the long run, this decreases the heart's elasticity and the volume, and so the heart can't really fill properly and further perpetuates heart failure. And the third way your body can compensate is by pumping faster. And so this allows your heart to pump more blood around your body, but in the long term, this can also increase the strain on the heart. And so there are different causes for heart failure. The first is coronary artery disease, and basically it's a buildup of fatty deposits or plaque in your arteries, which reduces blood flow and could lead to a possible heart attack. There's hypertension, and so this is chronically raised blood pressure. And this, when your blood pressure is really high, it forces your heart to work really hard. And this extra exertion can make your heart muscle really stiff or really weak, as we saw in the previous slide. And this can make it too weak to effectively pump blood around your body. And the third is valvular heart disease. So this is a damaged heart valve due to either heart defect, coronary artery disease, or heart infection. And this forces, once again, your heart to work harder, and it weakens it over time. And the fourth, probably like major contributing factor, is lifestyle. So things like healthy eating, exercise, smoking, alcohol, and things like that can really increase risk for heart failure if not performed correctly. And an interesting fact is over 600,000 Canadians are living with heart failure, and up to 40 to 50 die within 5 years of diagnosis. So clearly, this is a condition that's really serious, and it's really important that we learn how to treat it appropriately and manage it effectively. So we can look at some symptoms of congestive heart failure. Symptoms you may notice when you first experience heart failure is maybe some fatigue, so feeling really tired all the time, swelling your ankles, feet, or legs, weight gain, and increased need to urinate, especially at night. Some symptoms that indicate your condition has worsened would probably be like irregular heartbeat, a cough that develops from congested lungs, wheezing, and maybe shortness of breath, because once again, fluid can back up into your lungs. And finally, some symptoms that indicate a severe heart condition would be pain in your chest that radiates throughout your upper body, some rapid breathing, skin that appears blue because of lack of oxygen, and fainting. And so we want to manage congestive heart failure so it doesn't progress to the severe stage. And we have here stages of heart failure. So there are 4 classes, class 4 being the most severe, and we'll just run through them with some main symptoms and outlooks. So class 1 is when patients don't really experience any symptoms during typical physical activity. At that stage, CHF can still be managed through lifestyle changes, heart medications, and monitoring. Class 2 is when patients may be comfortable at rest, but normal physical activity may cause some fatigue, palpitations, or shortness of breath, and overall discomfort. At this stage, CHF can still be managed through lifestyle changes, heart medications, and careful monitoring. Class 3 is a little more severe. Patients are still likely comfortable at rest, but there's a limited physical activity before they feel fatigue, palpitations, or shortness of breath, and even mild exercise can cause this discomfort. And at this point, treatment can become very complicated, and it's a good idea to talk with your doctor about what this means for you. Class 4 is the most severe. Patients are unlikely to be able to carry out any physical activity, and symptoms may be even present at rest. And at this point, there is no cure for CHF, but there is still quality of life and palliative care options, and it's good to discuss the benefits of these options with your doctor.
So now we're going to talk about the different types of heart failure. So there's actually a few types. The first type we'll talk about is left-sided heart failure. So if we take a look at the heart over here, blood in the body, it comes into the right side of the heart and it gets pumped out to the lungs. And then from the lungs, it'll go back into the left side of the heart and get pumped out to the body through the aorta. So if we're talking about left-sided heart failure, that means the left side of the heart, which is receiving blood from the lungs, is not pumping as efficiently. So then what happens is that there will be fluid backup in your lungs, And that is what causes the shortness of breath that people experience if they have left-sided heart failure. If there's right-sided heart failure, then there's fluid backup in the abdomen, legs, and feet, and there's that swelling. And that happens because if we take a look here at the diagram, the blood is coming into the heart from the body into the right side. So if the right side is not pumping out the blood efficiently, then it's going to get pulled back, and it's going to kind of create like a traffic jam. And if there's not enough like pumping going on here, then the body is going to keep that blood, and that's when you're going to get that edema or the swelling in your extremities. And then left-sided heart failure can be categorized into two main types of heart failure, and this is because the left side of your heart is actually the biggest muscle in the heart, the left ventricle. So if we take a look here, so this is how blood will pump into the body. So you can see, like we mentioned, it comes into the right side and it goes out to the lungs, and then it comes back into the left side and goes out to the body. So if we have left-sided heart failure, the ventricle becomes enlarged. So this is actually systolic heart failure, where the blood is able to fill into the ventricle. However, it's not being able to be pumped out as much. So if we take a look at the normal heart again, you can see that it's pumping out at a good beat and it's contracting efficiently. But in this side, it's not contracting as well. So that's what it would be called systolic heart failure. If we talk about diastolic heart failure, that's when the ventricle is very stiff and it's not able to fill up enough. So if it's not filling enough, it's not pumping out enough blood, and then that causes the diastolic heart failure. So we can see over here, the systolic heart failure is the muscles very weak, it's not contracting as efficiently, whereas in diastolic heart failure, the muscle is very stiff and it's not pumping out enough blood. So there's two types of heart failure. There's preserved ejection fraction, which is essentially the diastolic heart failure. So that's when the left ventricle is very stiff and it's not pumping out enough blood. Then there's the reduced ejection fraction, which is systolic heart failure. So the left ventricle is not contracting enough, and then it's not pumping out enough blood. So when I'm saying the word ejection fraction, what I'm referring to is the amount of blood that the left ventricle is pumping out with each contraction. This is actually something that we measure when we do the echo test in the clinic. On the echo, we're able to measure the ejection fraction from the left ventricle. So a normal ejection fraction is 50 to 70%. A moderate ejection fraction would be 41 to 49%. You're kind of in a like orange or yellow zone right now. And then it would be a red zone if it's less than 40%. So that's something that we can find out on the echo. Another method of diagnosing heart failure is by doing a blood test that measures the BNP in your bloodstream, the brain natriuretic peptide. Now, right now in Ontario, this blood test costs $75. It is not free from the government, and that's because it's still a bit new and they're still trying to figure out the cost-benefit aspect of this blood test. I personally think it's quite interesting, and I'm interested to see if the government ends up covering this blood test. But essentially, a brain natriuretic peptide is a biomarker. It's a cardiac biomarker in your bloodstream that determines how hard your heart is working. So if you have elevated levels of BNP in your bloodstream, that means it's an indication that your heart is working extra hard to pump the blood. And that will usually happen if you have heart failure or you have some type of other issue with the heart where it's not functioning at its regular level. So a normal level of BNP is usually less than 100 picograms per milliliter or less than 200 for patients with kidney failure. Elevated levels could be more than 300, and that would indicate that there could be heart failure in the body. But keep in mind that heart failure consists of a various number of symptoms and tests in order to diagnose it. So this might just be one test that the doctor is going to prescribe for you just to help with his diagnosis. There's also another biomarker that we can look at. It's a precursor for BNP. It's called NT-proBNP. So N-terminal pro-brain natriuretic peptide. And that will also become elevated if your heart is working too hard. So normal levels are less than 125 picograms per milliliter, or the older you are, the higher levels you will have in your bloodstream. So the cutoff range is a bit higher. And then elevated levels would be higher than 450 or over 900. However, keep in mind that these numbers are also still being researched because there is a lot of current research going on with this specific blood test and the levels that they are looking at.
Interesting. BNP, or brain natriuretic polypeptide, was first discovered in the brain. But you know what? It's not really found in great concentrations. It's found in much higher levels in the heart. And it turns out if the pressure inside the heart's elevated, or the volume where it gets stretched, the heart, that the value goes up. So it now becomes a marker for congestive heart failure. Now there's other causes of elevation, but one of the things that we learned that it goes up in congestive heart failure for many individuals. Other things that make it go up as you get older, an irregular heartbeat called atrial fibrillation, renal dysfunction, these all cause elevation. The other thing, quite surprisingly, is the more you weigh, the lower the BNP level is. And so that's something we're learning about, and maybe it gets stored in fat cells, we don't know. But we need to make adjustments. So the team has put together a presentation about BNP, and we're learning about it. Now, to get into any research trials, and you saw that we're involved in the congestive heart failure trial called EMPERA congestive heart failure, and that trial used these BNP or pro-BNP levels to get into the trial. You can see that a value over 300 in the study is said to be significant. In fact, this may be even a lower value. I get concerned when I see values over 100 for many individuals and need to adjust it for what you need. There's another test called pro-BNP, and there's different conversions that may or may not work, but on average, a person who has a pro-BNP, that value, you have to multiply by 3 to 4 to get to a BNP. Now, that's not accepted by everyone. The bottom line is I really like this marker because the higher the value, the higher your risk. And we don't need it in every individual, but it certainly adds to level understanding. And so it's something that we're doing more and more of, and we're learning more and more about that. So let me help interpret your value for your context, and we can discuss whether or not it's worth getting in your condition. But most research papers evaluating congestive heart failure are using this marker.
So some cardiac causes of shortness of breath that kind of mimic the preserved ejection fraction heart failure. It might not just be congestive heart failure, it could be coronary artery disease, valvular heart disease. So we've just put up here a list of other diseases that could result from shortness of breath that are also related to the heart. And this is why the doctor uses so many tests and so many symptoms and kind of puts together the whole picture to be able to figure out what exactly is the cause of the shortness of breath. And these symptoms can present like preserved ejection fraction heart failure, which is why there's so many other potential reasons that could be the cause. Finally, there's a very interesting survey that was created by some clinicians or researchers, and it's a easy score that you can do for yourself to kind of measure how extensive your heart failure might be. So you can see here that there's several things that contribute. So if your BMI or your body, your mass to height ratio is greater than 30, then you will get 2 points in this survey. If you are taking 2 or more medications for blood pressure, then you get 1 point. If you have atrial fibrillation, which is something you can ask your doctor to diagnose for you, then you get 3 points. And then a few numbers on the echo test will also give you a point if it's there. If you're older than 60 years old, you automatically get a point. And then if your filling pressure is greater than 9, then you also get a point. So essentially, wherever you rank on this scale, so let's say that I got 4 points, I have like a 78% chance that I probably have preserved ejection fraction heart failure. So it's quite a neat tool to use with some available numbers that you can easily get from your doctor to kind of see where you sit on the scale, in addition to the doctor's guidance, of course.
So now we'll take a look at the non-cardiac causes for shortness of breath, and we'll begin with looking at COPD. So COPD stands for chronic obstructive pulmonary disease, and they're basically progressive inflammatory diseases that cause obstructed airflow in the lungs. So there are two types that we're going to briefly go over. The first one being emphysema. Now, emphysema is when the alveoli, or the little air sacs in your lungs, are damaged and the walls break down. And because the walls break down, they form larger air sacs as they fuse, and these sacs become enlarged, which overall results in a loss of elasticity. And without their normal elasticity, it causes the air to be trapped in the lungs, as when you inhale, these air sacs overinflate and then they cannot expel the air as well. And larger air sacs also move less oxygen into the blood, overall resulting in shortness of breath and difficulty breathing. And the main point with emphysema is that airways they have trouble staying open when breathing out, so your exhalation is inhibited. And now with the other type of COPD, with chronic bronchitis. So chronic bronchitis is when the bronchial tubes in your lungs become inflamed and the cilia lining these tubes are damaged or lost, which prevents them from clearing up the mucus. And the buildup of mucus causes more coughing, which increases irritation, swells the tubes more, and then this whole thing becomes a kind of cycle. Now, moving on, we'll compare COPD to another category of lung diseases, which are restrictive lung diseases. Now, with obstructive ones, it's more so to do with obstruction with exhalation, and inflammation swelling usually causes these airways to be blocked. And as I briefly mentioned before, it increases the residual volume of your lungs, which is the volume that's left after you breathe out, overall causing a hyperinflation of the lungs. Now, with restrictive lung diseases like pulmonary fibrosis or pneumonia, inhalation is the one that gets impacted as it fills up the lungs far less than normal, and overall preventing the proper expansion of the lungs, reducing the lung capacity and limiting the amount of oxygen that you can actually take in. Now, this is mainly caused by stiffening, inflammation, or scarring of the lung tissue, which is something within the lung and is intrinsic, or something around the lung, like the weakened muscles, damaged nerves, or stiffening of the chest wall. Now, one of the tests that I'm sure many of you have done when you come into the clinic is a spirometry test, which is the test that tests the function of the lungs and help diagnose these lung diseases. Now, how it works, I'm sure as many of you know, is that you place the mouthpiece in your mouth, seal it tightly, inhale as deeply as possible, and then exhale in the same way. And your top 3 best efforts are taken. And just going back a little bit to what we talked about before, we have the Emperor study, which is a study which we're currently conducting in our clinic. And with the Emperor study, it's 2 clinical research studies investigating the safety and effectiveness of a medication called Jardiance. And Jardiance is currently approved as a medication for treating type 2 diabetes, and it works by decreasing the amount of sugar in the blood by increasing the amount of glucose that's passed in your urine. So this is usually used for chronic heart failure patients with preserved or reduced ejection fraction, as we briefly mentioned. Now, participants are randomly assigned to either Jardiance or placebo, and the period is approximately 3 years overall, and the primary outcome being invested is either cardiovascular death or heart failure hospitalization. And just going a little bit further in depth with the whole period, first you have the screening period, which is up to 4 weeks of testing and questioning. And then you have the 3-year treatment period, where you have to visit the study center 5 times in the first year, and then every 6 months after that. Jardiance will be taken once a day every morning, and then from week 12 onward, we'll also be having telephone follow-ups 3 months after every visit. And after this 3-year period, we'll also have a follow-up period where you would visit the study center twice, once when you stop taking the medication and another time 30 days after your last dose.
So now that we know a little bit about what congestive heart failure is and some of the more biology behind it, as well as the study, we can go into talking a little bit about the management of congestive heart failure. And of course, the first way to manage congestive heart failure is through medications. So the goals of treating heart failure are essentially to decrease the likelihood of disease progression and to lessen the symptoms and essentially improve the overall quality of life. So here on the slide, we have a little bit of an activity for you. So we have medications, common ones that are used to treat congestive heart failure listed on the left-hand side, as well as sort of their function or mechanisms on the right-hand side. So you can take a second to just pause the video here and see if you can match the medication to its purpose. And on the next slide, we'll go over what the actual answers are, and you can kind of see if you got them right. So there's some medications like digoxin, which is essentially used to strengthen the force of the heart's contractions, whereas other medications are more used as a diuretic. So they're usually used to increase the excretion of water and sodium in the urine, and those would be spironolactone as well as Lasix. And another medication that we have here is Entresto. And what Entresto essentially does is it relaxes those blood vessels to help improve the blood flow. And we also have ACE inhibitors, which essentially lower your overall blood pressure, and beta blockers, which slow down the heart rate to basically give the heart more time to fill with blood.
Medications to manage congestive heart failure are quite complicated. And you can see that if your heart muscle is weakened, we call it systolic dysfunction. If your ejection fraction is less than 40%, we have life-saving medications. In fact, it's a group of medications. Initially, when they were first developed, they were to block blood pressure and to vasodilate. But more importantly, we discovered that they block hormones. For instance, beta blockers, your sort of flight or flight reflex, is the catecholamine system, and it becomes overactivated, so we now downregulate it. Digoxin is a medication that just makes the heart pump stronger. It's been around for a long time. Water pills are to get rid of the excess fluid. And then these neurohormonal blockades, such as ACE, ARB, Entresto, block hormones that harm the heart. We're now learning that SGLT2 receptor antagonists, especially in patients who have a weak heart muscle, are of proven value in diabetes, and it looks like they're very valuable outside the field of diabetes. We're learning more. In stiff hearts, they're being evaluated right now. We're really privileged to participate in clinical trials and research and lots of reading. The bottom line is that you really need to rely on experts to help it, and we're not using these medications to lower blood pressure. We're using these medications to protect the heart, make the heart stronger in many circumstances. They're life-saving.
So another way to manage congestive heart failure is through just monitoring your symptoms yourself. And so what you should be doing every day is weighing yourself in the morning before breakfast and just keeping track of your weight day by day, and make sure that you compare it to the day before. Another thing to do is to sort of control the total amount of fluids that you drink, and to keep them limited to about 6 to 8 glasses each day. And along with that, as we mentioned before, when medications are used to treat congestive heart failure, it's important to also ensure that you're taking those medications properly, with the right dose and the right amount as the doctor has said. And another thing, we mentioned swelling as being one of the main symptoms of congestive heart failure. So make sure you're checking for swelling in your feet, your ankles, your legs, and your stomach, and just keeping track of if it's getting worse or better as the days go on. And some other things we'll talk about later on as well are eating foods that are sort of low in salt or salt-free, and just ensuring that you're watching your diet overall to make sure that you're having more of a balanced diet. And the final one is to balance activity and rest periods. So there's a few different zones that you can use to sort of see where your symptoms are at, and whether you need to take action, and if so, what action you should take. So the first one is the green zone. Naturally, it's the safe zone. So this is when you have your symptoms under control. So you don't have any shortness of breath, you don't feel any chest discomfort or any type of pressure or pain, and you're noticing that you aren't really getting any swelling, or your swelling isn't getting worse in those areas I mentioned, being feet, ankles, leg, and stomach. And like I said before, keeping track of your weight. So in the green zone, you would not have any weight gain of more than 4 pounds over 2 days in a row, or 5 pounds in 1 week. So again, it's important to keep track of your weight every day. The next zone is sort of the yellow zone or the caution zone. So you can consider this zone to be a warning. So symptoms in this zone would be weight gain that's a lot more. So you have more than 4 pounds over 2 days in a row or 5 pounds in 1 week. Other symptoms you might notice we've mentioned before, so vomiting or diarrhea, shortness of breath, increased swelling. You might feel more tired than you usually do and feel more exerted, or you also might feel lightheaded or dizzy that you normally would not feel otherwise. And you might also find it harder to sleep, and you might find that you need assistance of adding pillows or sitting in a chair. So if you have any of these symptoms, it's important that you call your healthcare provider. So booking an appointment with Dr. Curnew as soon as possible to ensure that you're getting it checked out, as this would be the zone where it's considered a warning. So moving along, you have the red zone or the danger zone, and this is the zone that no one wants to be in, of course. This means that there's an emergency, so you need to act fast. You don't have to wait to kind of call your healthcare provider. You would just straight call 911 if you have any of these symptoms. So if you're really struggling to breathe or your shortness of breath doesn't go away, make sure you call 911, including if you have a really fast heartbeat or chest pain that is very, very persistent and it doesn't go away with any of your medications, along with, of course, if you have trouble thinking or if you've fainted. So again, this is a danger zone, so make sure that you're taking action right away if any of these symptoms appear. So we mentioned a couple of times, but the first way to sort of maintain congestive heart, from the disease from progressing would be exercise. So the Canadian Physical Activity Guidelines recommend that you get at least 150 minutes of moderate to vigorous intensity per week in sessions of 10 minutes or more. And so the reason exercise is so important is that it really helps to improve your circulation and it helps your body use the oxygen a lot better. So it sort of improves those COPD symptoms that we discussed earlier and strengthens your heart overall, along with maintaining bone health and improving muscle tone. So a couple of examples of exercise would be just walking or bicycling or swimming. Of course, given the circumstances right now, you might find it a little bit more challenging to take part in these activities. So just sort of think around in your own home environment and see how you can incorporate exercise in your daily life. So examples would be even just taking a small walk in your neighborhood or taking a stroll in your backyard, along with if you have stairs at home, for example, you can go up and down the stairs for a few minutes and just making sure that you're looking for ways that you can keep moving and keep active and not stay sort of sitting or sedentary. And this would really help in sort of improving your circulation and strengthening your heart overall. The second way, along with exercise, is of course healthy eating. So you really do need both of these things in order to maintain your health overall. So with healthy eating, that means eating plenty of vegetables and fruits and choosing protein foods that come a lot more from plants and sort of avoiding processed foods which are high in sodium, fats, or cholesterol. And whenever possible, it's always best to sort of cook your food from home and have it more fresh rather than consistently ordering out and eating highly processed foods. So ensuring that you're having more of a balanced diet is really essential. You can see here on the plate, we have vegetables and fruit, protein, as well as wheat and grains. So if you're looking for more information on that, you can always visit Canada's Food Guide, and they'll give you exact portions of what you should be eating from which category. And another thing I would want to mention here is that it's also important to be eating mindfully. So a lot of the times when we're eating, we tend to sort of go on our phones or not really pay attention to the meal we're having. So a lot of research has shown that eating mindfully and being aware of what you're eating and really taking in the taste of what you're eating is important to ensure that you're sort of being aware and having that healthy balance in your life. So there are other resources available in the community and different programs that have been set up that can help you improve your lifestyle. One of them is the Cardiac Health and Rehabilitation Center, and there they have a team of nurses, physicians, and dietitians that are there to help improve your health with different programs in exercising or weight control or stress management. And this is located in the Hamilton General Hospital, and their contact information is listed here on the slide if you're interested. There's also the North Hamilton Community Health Center, which is a 10-week community-based program that helps you gain control specifically of your COPD. So they offer a variety of different sessions. So there's group and individual education, peer support. There's also education sessions for family and caregivers, as well as exercises, smoking cessation counseling and support, and just sort of helping you track your progress and having that extra support system there to help you out. So this is offered again with the Compass Community Health, and the address and the contact information is listed there as well. So there's also the smoking treatment for Ontario patients. So the Hamilton Public Health Services hosts this smoking treatment for Ontario patients, or the STOPS program. And these are sessions to help people quit smoking. So again, smoking is one of the main risk factors for COPD and congestive heart failure in general. So the STOP sessions will help you get on track with free nicotine patches, as well as practical support for managing nicotine withdrawal, and give you extra educational material to encourage you to take more of a broader change that can help improve your overall health. So the sessions are also listed here. These dates are a little bit outdated, but you can feel free to give them a call to see when their next sessions would be as well.
There's never the perfect time to do anything, but to me, it's always a good time to work on risk factor modification, including smoking. As you know, every time you smoke, 5 minutes of life is lost, and taking steps to actually reduce or stopping tobacco is important. So yes, you can be short of breath if you have congestive heart failure. Yes, you can be short of breath because you have COPD that was well described. Let's take steps to work in this direction. You have a picture of my cat Tigger. She's sleeping on my my bag, and I'm always reading, and she's always by my side. But this cat is a little kitten, very curious, always learning new things. So this cat has taught me to be curious. So I hope we satisfied your curiosity and lots to learn. And yes, this is complicated. Also, we're learning all the time. Now, one of the tools that's important is the best way to treat congestive heart failure is to prevent it from happening in the first place. So we're asking people to be really actively involved in your health. So you saw some slides about weighing yourself on a regular basis. I weigh myself every day, and today I weigh 169 pounds. Yesterday I weighed 172 pounds. Now that is start naked after exercise. I'm not going to show you what I look like start naked. It's a scary thought. But really importantly is that weighing yourself on a consistent basis, usually first thing in the morning, it's a great thing to do on your scale. Weight will fluctuate. My weight has changed by 3 pounds over one day. Now, does it mean I'm a congestive heart failure? Not necessarily, but you can see how weight fluctuates. And weighing yourself. So one of the things that I'm trying to do is be as healthy as I can. And so last night, I fell a little bit off the wagon. I ate too much last night. That was, with Easter coming up, there's those Easter chocolates. And so today I decided, well, you know what? I'm going to burn off those calories. I went for a 50-kilometer bike ride. Now, I'm not saying do a 50-kilometer bike ride, but to me is that one of the ways to prevent heart failure and to treat heart failure is getting my weight down. So my goal weight is 165 pounds. I'm right now somewhere around 170 pounds. I still have another 5 pounds to go. This time last year, I was 15 pounds heavier. So it's a constant work in progress. I can do it. You can do it. My blood pressure today is 123/78. My pulse is 68 beats per minute. you should be in charge of your health, and we'll work together. So I want to thank you for listening to this talk, learning about this talk, and the people involved. I have to really thank them. They did such a fantastic job of summarizing a number of facts. So let's work together. Here's Toffee that comes in over here. This is Toffee over here. Toffee's been around for about 10 years or so, and this here's our little cat over here. Here's Tigger over here. So here's Tigger saying, hello everybody, be healthy and find ways to keep out of trouble, okay? So if you have congestive heart failure, you're going to treat it. If you don't have congestive heart failure, let's work on preventing it. So have a great day, and look forward to seeing you soon. Oh, one more dog. Go.
It
This
should
is
be.
Louie. And this is here. Come here, Toffee. You come here too. You want to be part of the game too as well. So I think, you know, quality relationships are important, and we have 3 dogs, 3 cats, and you all are very important. You're all part of the family, and we all wish you a good day.